Hello and welcome to EULAR TV, coming to you from London today. My name is Pratasha Saha. I'm a clinical research fellow at the University of East Anglia, UK, and it's my pleasure today to be here with Professor Pedro Machado, Professor of Rheumatology and Neuromuscular Diseases at University College London. Thank you for joining us today, Professor Machado.
Thank you for the kind invitation.
You're giving a presentation about emerging infections, infection prevention, vaccination, and managing immunodeficiency in rheumatology. In your opinion, what are the main infection risks facing us in rheumatology at this current moment in time?
Well, most of our patients will be treated with some kind of immunosuppressive or immune modulatory drug, and therefore that they are at increased risk of infection. Obviously, at baseline, when we make a diagnosis and we're about to start this type of treatments, it's important to screen for chronic infections because these might be triggered by this type of drug. So we need to screen for things like latent TB, chronic hepatitis B and C, and HIV.
Absolutely.
The most common type of infection is probably upper respiratory tract infection. So general measures of protection against infection should be undertaken. And it's critical to update the vaccination schedule. So, one needs to vaccinate annually for influenza, COVID-19 boosters, and anti-pneumococcal vaccination every 5 years. Those are essential measures to protect our patients from infection.
Absolutely. So moving on to vaccination, actually, we know it's such an important part of infection prevention, as you said, but uptake and timing can sometimes be difficult in busy clinical practice. Do you have any practical strategies for clinicians trying to embed vaccination into routine clinical care?
Well, I think there's been a change of paradigm over the last few years. And in the same way that controlling disease activity and treat to target have become pillars of rheumatological management in modern rheumatology, infection prevention should also be one of those pillars. Mm-hmm. So we should integrate those concepts in our daily clinical practice in the same way we ask about adverse events, in the same way we check disease activity. We should also make sure that we're checking that vaccination is up to date. We should give strong messages to the patients about confidence in the safety and efficacy of vaccination. And if we're using electronic medical records, there could be some prompts that can be used in clinical practice. So essentially, nowadays, infection prevention is as important as disease activity, as controlling disease activity, and should be an essential component of rheumatological management.
Mm-hmm. Absolutely. And lastly, in looking to the future, are there any particular scientific developments that you're hopeful for in the area of infection prevention in rheumatology?
Well, more recently, we've witnessed new technologies in terms of vaccine development. I think this will lead to important developments over the next few years. Obviously, we'll still need to learn more about those technologies and the efficacy, especially in patients that are immunocompromised. Another aspect that I think is still a research gap is the fact that often we use immunogenicity and development of antibodies, for example, as a surrogate for clinical efficacy, but in fact, they do not replace clinical efficacy in terms of hospitalizations or even death. So I think there's still a lot to do in terms of surrogate biomarkers of efficacy that will allow us to learn more about the efficacy of certain vaccinations over a shorter period of time. Mm-hmm.
Thank you so much for your answers today and for letting us interview you as part of EULAR TV. And thank you to everyone watching. Have a fantastic rest of Congress.